Hi, good afternoon again. This is Anastasia Flanagan, the sales consultant for Meloq, and thank you very much for following up on our call. And it's a pleasure to once again be able to meet you and to present a little bit to you about how we can best meet your needs. Thanks to our last conversation, I learned a lot about the type of work that you do. I know that you are under intense pressure to minimize cost and also to make all the treatments efficient on time. That's from the side of the healthcare system. From the side of the patient, you often have the patient that is either dealing with some sort of reduced mobility or trauma. Historically, it could be also a child or a senior person whose ability to cooperate is not always 100%. It, it is very important work that you do because we tend to take our joints for granted, but our mobility and our quality of life depends on this. And for some people, such as athletes, this is the ability to rehabilitate joints and return them to normal function. It is a career affecting decision for sure. I really think that I understand you, and I understand also your historic practice and how you're used to doing things with regard to goniometers and the measurements that you take on how joints move over time and how they change in flexibility. I'd like to show you what we've got actually. I think you might like it. If you don't, we can discuss it, of course, and we will develop on that and take that into consideration. But I'm sure that this actually here you have this device. This is called the Easy Angle. Please have a look at it. Please touch it, turn it on. You can see that it's digital. So it's a one push interface, and you can see the measurements on the screen there. You can see how lightweight it is. It's meant for being used with one hand only. It's a portable device. Your other hand is free to support your patient or even to start typing in the results in your computer as you do the measurements. It's quite easy to use. I mean, it's definitely quicker to use than the traditional approach when joints are rotated and tested at various planes. Here's how you place it on the table, align it to a plane, and then tilt it in different directions, and you can see the flexibility of any joint. So that's right. I mean, instead of multiple approaches and potentially multiple devices, think about it, no bone pins, no 3D biomechanical systems. You just have this one easy angle that is easy to carry in a non-clinical setting. You can use it even at an outpatient facility. The number that you see lighting up on the screen is an objective measurement that can be entered into your computer, and you can monitor that over time. The patients have varying degrees of motivation and diligence when it comes to doing their homework. When it comes to also, I mean, objectively, sometimes I'm sure there are degenerative diseases of the joints. So with the easy angle, the objective measurement that you take every single time will give you and the patient no questions asked measurements for how the evolution of the joint is. I think that is that is that is very valuable to pass on to your colleagues and also to keep for the keeping of medical records. Not to mention that in an insurance driven system or any sort of cost driven system, as modern healthcare systems are, the amount of time that you spend on each patient is important. I realize that this is a lot of information to take in one go. What I offer you is this. How about you take this easy angle into your practice for a week? Try applying it in your therapy sessions as you usually do, with children, with adults, with seniors, in various situations, including challenging ones. And you can keep it for 1 week and try to keep track of however much you can of the time spent on this joint flexibility measurement compared to your usual time spent on this. This would be absolutely fantastic if you could do this, and we could come back to that. Furthermore, I think if you would like to use it longer, we would like to know about how the quality of the follow-up and the communication with the patients is affected by easy angle. Our hope is that it will be affected dramatically, that we will develop the sort of self-responsibility and consciousness in the patient that is often lacking when they vest all the responsibility on the caregiver. Now, this is just not right, and this is not sustainable. We think of easy angle as something that can increase life quality for the patient, create a more streamlined, reliable, and safe process for you to communicate with the patient and help you save time. How you use your time is up to you. Could be to see another patient, could be to maybe use it for clinical related tasks, or it could be even to have a cup of coffee. I mean, we all need a break every now and then. So here is your easy angle, and I hope that it will just make life easier for you. And I will hear back from you in a week's time. If you have positive feedback, then we can take this discussion one step further and see if you would like to keep this easy angle here and just budget it in your clinic's expenses. Thank you so much.